Well, expectant mothers in Greater Lafayette are scrambling after learning that IU Health Arnett will no longer allow midwives to deliver babies at the hospital. Dozens protested at the hospital this afternoon. News 18's Perry Apostolakos is live where that demonstration is wrapping up right now. Perry, you spoke with a former midwife who says she's now heartbroken about the hospital's decision.
That's right, Jeff. That former midwife actually handed in her resignation letter here at IU Health Arnett Hospital last week after receiving just 24 hours notice of the termination of her practice. And in response, multiple people have come out in support of her and all the midwives who work at IU Health Arnett, and they are standing here today in protest. The protest has been going on since about 1 p.m. I'm going to step aside so that you can take a look at all the people who are here right now. At last count, we had about 50 participants here. There have been about 24 or so more coming and going throughout the day, the 5 hours that this protest has been going on. It is winding down right now, but they are still here to have their voices heard. And that one midwife says that she can no longer do what she loves to support her 6-month-old son. Take a look.
It's always been more than a job for me. It's been my greatest joy in my life to care for women, and that's been ripped away from me with no notice.
For over 7 years, Shara Albright was a midwife at IU Health Arnett Hospital. She says she has delivered about 500 babies. Last week, she was told the midwife practice at the hospital was being paused indefinitely. The hospital released a statement Tuesday saying midwives will no longer be able to perform deliveries, but they could give care on an outpatient basis.
I did not go to school for 1,000+ hours of training, and I have not been working my heart out for this organization for 7 years to be working in an office. I became a midwife so I could help women give birth to their babies. I didn't become a midwife to be sitting in an office.
She calls the communication from IU Health Arnett abysmal, claiming her patients were lied to about why she wasn't there to treat them.
And patients were being told that I had a family emergency, so I had people contacting me, and I had to explain to them that the family emergency was not caused by anything like that. It was from IU Health.
When it comes to why this is happening now, hospital spokespeople have declined to explain, but Albright says money and lack of respect for midwifery from obstetricians and gynecologists could be factors.
We had 2 very supportive obstetricians that were supportive of the midwife program, that were making sure that we were able to practice the way we wanted to. And then when they retired, several of the OBGYNs that are currently practicing decided they did not want to work with us anymore. They have doctors who are able to perform surgeries, who can bring in revenue for the organization. And we have been told many times that we aren't revenue generators for the organization.
Albright says she has kept statistics for the practice since 2016. She says the midwives have low cesarean section rates, low rates of babies admitted to the NICU, preterm birth, 3rd and 4th degree lacerations, and postpartum hemorrhage. In a word, Albright feels betrayed.
These doctors are colleagues that I've worked with for 7 years. I've worked alongside them. I've taken care of their patients for them when they weren't able to. And they left me without a job. Purposely.
Your dad. Baby boy.
The doctor that delivered my son, when I had to transfer to the hospital because he wasn't able to be born vaginally, she was leading the charge against me losing my job after I trusted her with my life and my son's life. I'm just heartbroken.
Kristen Norman says Albright is one of her favorite midwives she worked with in her past 2 births.
They were great. They cared for me well. They listened to my concerns. I felt like they really took the time to get to know me and understand my needs.
Expecting her 3rd child in July, Norman panicked when she heard the midwife practice was being dissolved indefinitely. The closest similar practice where midwives can deliver babies in a hospital is located about an hour away in Indianapolis.
I feel like I don't know what to do. I feel really helpless right now.
Women deserve options. Women deserve to have the care that they want and that honors their values for birth.
News 18 has repeatedly reached out to IU Health Arnett Hospital for comment on the reasons behind this decision and for a response to Albright's claims. They have declined every time. Reporting live in Lafayette, Perry Apostolakos, News 18.